1. What is the primary cause of myocardial infarction? A. Hypertension. B. Atherosclerosis. C. Valvular disease. D. Congenital defect. Answer: B. Atherosclerosis. Rationale: atherosclerosis, the buildup of plaque in coronary arteries, is the primary cause of MI by obstructing blood flow. Hypertension is a risk factor, not the direct cause. Valvular disease and congenital defects may contribute to heart issues, but are not the leading cause of MI. B is correct. 2. Which risk factor is most strongly associated with myocardial infarction? A. Smoking. B. Obesity. C. Stress. D. Sedentary lifestyle. Answer: A. Smoking. Rationale: smoking is the strongest modifiable risk factor for MI due to its role in accelerating atherosclerosis and reducing oxygen delivery. Obesity, stress, and sedentary lifestyle contribute but have less direct impact compared to smoking's vascular effects. A is correct. 3. What is the classic symptom of myocardial infarction? A. Shortness of breath. B. Chest pain. C. Fatigue. D. Nausea. Answer: B. Chest pain. Rationale: chest pain, often described as heavy or squeezing, is the hallmark symptom of MI due to myocardial ischemia. Shortness of breath, fatigue, and nausea may occur, but are less specific. B is correct as the classic presentation. 4. Which EKG finding is most indicative of an acute myocardial infarction? A. T-wave inversion. B. ST elevation. C. Q waves. D. Prolonged PR interval. Answer: B. ST elevation. Rationale: ST elevation on an EKG indicates acute myocardial injury from occlusion, typical in STEMI. T-wave inversion and Q waves may appear later, and prolonged PR interval is unrelated to acute MI. B is correct for acute diagnosis. 5. Which lab test is the gold standard for diagnosing myocardial infarction? A. CKMB. B. Troponin. C. Myoglobin. D. LDH. Answer: B. Troponin. Rationale: troponin is the gold standard due to its high specificity and sensitivity for myocardial necrosis, rising within 3 to 4 hours and persisting for days. CKMB is less specific. Myoglobin rises early but lacks specificity, and LDH is outdated. B is correct. 6. What is the initial treatment priority for a patient with myocardial infarction? A. Beta blockers. B. Oxygen therapy. C. Thrombolytics. D. Statins. Answer: B. Oxygen therapy. Rationale: oxygen therapy is the initial priority to improve myocardial oxygenation and reduce ischemia. Beta blockers and statins are later steps, and thrombolytics depend on timing and type of MI. B is correct for immediate care. 7. Which complication of MI is most likely to cause sudden death? A. Heart failure. B. Ventricular fibrillation. C. Cardiogenic shock. D. Pericarditis. Answer: B. Ventricular fibrillation. Rationale: ventricular fibrillation, a lethal arrhythmia, is the most common cause of sudden death post-MI due to disrupted electrical activity. Heart failure and cardiogenic shock are serious but less immediately fatal, and pericarditis is not typically fatal. B is correct. 8. What lifestyle change is most effective in preventing myocardial infarction? A. Weight loss. B. Smoking cessation. C. Regular exercise. D. Low-fat diet. Answer: B. Smoking cessation. Rationale: smoking cessation has the greatest impact on reducing MI risk by halting vascular damage and improving oxygen delivery. Weight loss, exercise, and diet are important but less impactful individually compared to quitting smoking. B is correct. 9. Which coronary artery is most commonly occluded in myocardial infarction? A. Left circumflex. B. Right coronary. C. Left anterior descending. D. Posterior descending. Answer: C. Left anterior descending. Rationale: the left anterior descending (LAD) artery supplies the largest portion of the left ventricle and is most commonly occluded in MI, leading to significant damage. Other arteries can be involved but are less frequent. C is correct. 10. What is the primary pathophysiological event in myocardial infarction? A. Coronary spasm. B. Plaque rupture. C. Embolism. D. Vasculitis. Answer: B. Plaque rupture. Rationale: plaque rupture in a coronary artery triggers thrombus formation, obstructing blood flow and causing MI. Coronary spasm, embolism, and vasculitis can contribute but are not the primary event. B is correct. 11. Which medication is given to all MI patients unless contraindicated? A. Aspirin. B. Nitroglycerin. C. Morphine. D. Heparin. Answer: A. Aspirin. Rationale: aspirin is given to all MI patients unless contraindicated due to its antiplatelet effect, reducing thrombus growth. Nitroglycerin, morphine, and heparin are used but not universally required. A is correct. 12. A patient with MI reports jaw pain. This is an example of A. Referred pain. B. Angina pectoris. C. Muscle strain. D. Anxiety. Answer: A. Referred pain. Rationale: jaw pain in MI is referred pain, a common atypical symptom due to shared nerve pathways with the chest. Angina is chest pain, muscle strain is unrelated, and anxiety may coexist, but doesn't explain the symptom. A is correct. 13. Which diagnostic imaging is used to assess MI-related wall motion abnormalities? A. Chest X-ray. B. Echocardiogram. C. CT scan. D. MRI. Answer: B. Echocardiogram. Rationale: echocardiogram assesses wall motion abnormalities post-MI by visualizing heart function. Chest X-ray detects lung issues, CT scans identify occlusion, and MRI is less common acutely. B is correct. 14. What is the time window for administering thrombolytics in MI? A. 6 hours. B. 12 hours. C. 24 hours. D. 48 hours. Answer: B. 12 hours. Rationale: thrombolytics are most effective within 12 hours of symptom onset in MI to restore blood flow. Beyond this, efficacy drops significantly. A is too short, and C and D are too late. B is correct. 15. Which arrhythmia is most common immediately after an MI? A. Atrial fibrillation. B. Ventricular tachycardia. C. Bradycardia. D. Heart block. Answer: B. Ventricular tachycardia. Rationale: ventricular tachycardia is common post-MI due to irritable ischemic tissue. Atrial fibrillation, bradycardia, and heart block can occur but are less frequent acutely. B is correct. 16. What dietary change reduces MI risk? A. High protein intake. B. Low saturated fat. C. Increased sodium. D. Low fiber. Answer: B. Low saturated fat. Rationale: reducing saturated fat lowers cholesterol and atherosclerosis risk, key in MI prevention. High protein, increased sodium, and low fiber do not directly reduce MI risk. B is correct. 17. Which symptom suggests cardiogenic shock post-MI? A. Chest pain. B. Hypotension. C. Fever. D. Cough. Answer: B. Hypotension. Rationale: hypotension is a key sign of cardiogenic shock post-MI due to pump failure. Chest pain is MI itself. Fever suggests infection, and cough relates to heart failure, not shock. B is correct. 18. What is the role of beta blockers in MI treatment? A. Reduce clot size. B. Lower heart rate. C. Dilate coronary arteries. D. Increase cardiac output. Answer: B. Lower heart rate. Rationale: beta blockers lower heart rate and oxygen demand, reducing myocardial workload post-MI. They don't affect clots, dilate arteries, or increase output. B is correct. 19. Which genetic factor increases MI risk? A. Family history of MI. B. Blood type O. C. Blue eyes. D. Height. Answer: A. Family history of MI. Rationale: A family history of MI indicates genetic predisposition to atherosclerosis and coronary disease. Blood type, eye color, and height are not directly linked. A is correct. 20. What indicates successful reperfusion after thrombolytic therapy? A. Increased troponin. B. Pain relief. C. Elevated ST segments. D. New Q waves. Answer: B. Pain relief. Rationale: pain relief indicates restored blood flow and reperfusion post-thrombolytics. Increased troponin reflects damage. Elevated ST persists initially, and Q waves show infarction, not success. B is correct. 21. Which medication is used to relieve chest pain in acute MI? A. Aspirin. B. Nitroglycerin. C. Metoprolol. D. Atorvastatin. Answer: B. Nitroglycerin. Rationale: nitroglycerin relieves chest pain in MI by dilating coronary arteries and reducing preload, improving oxygen supply. Aspirin prevents clot growth. Metoprolol lowers heart rate, and atorvastatin manages cholesterol, but none directly relieve acute pain. B is correct. 22. What is a major modifiable risk factor for MI? A. Age. B. Diabetes mellitus. C. Gender. D. Family history. Answer: B. Diabetes mellitus. Rationale: diabetes mellitus is a major modifiable risk factor for MI through lifestyle and medical management, as it accelerates atherosclerosis. Age, gender, and family history are non-modifiable. B is correct. 23. A patient with MI presents with diaphoresis. This is due to A. Fever. B. Autonomic response. C. Dehydration. D. Anxiety. Answer: B. Autonomic response. Rationale: diaphoresis in MI results from an autonomic response to pain and stress, activating the sympathetic nervous system. Fever, dehydration, and anxiety may cause sweating but are not the primary mechanisms in MI. B is correct. 24. Which EKG change indicates a previous myocardial infarction? A. ST elevation. B. T-wave inversion. C. Pathologic Q waves. D. Peaked T waves. Answer: C. Pathologic Q waves. Rationale: pathologic Q waves indicate a previous MI due to permanent myocardial necrosis and scarring. ST elevation is acute, T-wave inversion is subacute, and peaked T waves suggest hyperkalemia, not MI. C is correct. 25. What is the purpose of measuring troponin levels in MI? A. Assess clot formation. B. Detect myocardial necrosis. C. Monitor inflammation. D. Evaluate kidney function. Answer: B. Detect myocardial necrosis. Rationale: troponin levels rise with myocardial necrosis, making them specific for MI diagnosis. They don't assess clots, inflammation, or kidney function directly. B is correct. 26. Which intervention is contraindicated in MI with hypotension? A. Oxygen therapy. B. Nitroglycerin. C. Morphine. D. Heparin. Answer: B. Nitroglycerin. Rationale: nitroglycerin is contraindicated in hypotensive MI patients as it lowers blood pressure further by vasodilation, worsening perfusion. Oxygen, morphine, and heparin are safe if monitored. B is correct. 27. What is a common late complication of MI? A. Ventricular rupture. B. Heart failure. C. Pulmonary edema. D. Dressler syndrome. Answer: B. Heart failure. Rationale: heart failure is a common late complication of MI due to reduced pump function from myocardial damage. Ventricular rupture is early and rare, pulmonary edema is acute, and Dressler's is less common. B is correct. 28. Which exercise recommendation is best for MI prevention? A. 30 minutes most days. B. 10-minute daily. C. 1 hour weekly. D. Intense daily sprints. Answer: A. 30 minutes most days. Rationale: 30 minutes of moderate exercise most days reduces MI risk by improving cardiovascular health and lipid profiles. Less frequent or overly intense options are less effective or risky. A is correct. 29. What does ST elevation in leads V1, V4 suggest in MI? A. Inferior wall MI. B. Anterior wall MI. C. Lateral wall MI. D. Posterior wall MI. Answer: B. Anterior wall MI. Rationale: ST elevation in V1, V4 indicates an anterior wall MI, typically due to LAD occlusion. Inferior, 2, 3, AVF. Lateral, I, AVL, V5, V6, and posterior, V7, V9. MIs affect different leads. B is correct. 30. What triggers thrombus formation in MI? A. High cholesterol. B. Plaque rupture. C. Hypertension. D. Smoking. Answer: B. Plaque rupture. Rationale: plaque rupture exposes thrombogenic material, triggering thrombus formation and vessel occlusion in MI. Cholesterol, hypertension, and smoking contribute to plaque, but don't directly cause the thrombus. B is correct. 31. Which antiplatelet drug is commonly paired with aspirin in MI? A. Clopidogrel. B. Warfarin. C. Heparin. D. Alteplase. Answer: A. Clopidogrel. Rationale: clopidogrel is paired with aspirin for dual antiplatelet therapy in MI to prevent further clot formation. Warfarin and heparin are anticoagulants, and alteplase is a thrombolytic, not antiplatelet. A is correct. 32. A female patient with MI reports epigastric pain. This is A. Atypical presentation. B. Gastrointestinal issue. C. Referred pain. D. Both A and C. Answer: D. Both A and C. Rationale: epigastric pain in MI is an atypical presentation, especially in women, and a form of referred pain due to shared nerve pathways. It's not primarily gastrointestinal. D is correct as it encompasses both aspects. 33. Which test confirms coronary artery occlusion in MI? A. Echocardiogram. B. Cardiac catheterization. C. Stress test. D. Chest X-ray. Answer: B. Cardiac catheterization. Rationale: cardiac catheterization directly visualizes coronary artery occlusion in MI and guides intervention. Echocardiogram assesses function. Stress tests are pre-diagnostic, and X-rays are nonspecific. B is correct. 34. What is the maximum time for PCI to be most effective in MI? A. 30 minutes. B. 90 minutes. C. 3 hours. D. 6 hours. Answer: B. 90 minutes. Rationale: percutaneous coronary intervention, PCI, is most effective within 90 minutes of first medical contact, door-to-balloon time, to restore flow and minimize damage. Shorter is ideal, but longer reduces efficacy. B is correct. 35. Which post-MI complication involves inflammation of the pericardium? A. Cardiogenic shock. B. Pericarditis. C. Ventricular aneurysm. D. Papillary muscle rupture. Answer: B. Pericarditis. Rationale: pericarditis involves pericardial inflammation post-MI, often days later. Cardiogenic shock is pump failure, ventricular aneurysm is wall bulging, and papillary rupture affects valves. B is correct. 36. Which nutrient should be limited to prevent MI? A. Fiber. B. Trans fats. C. Protein. D. Carbohydrates. Answer: B. Trans fats. Rationale: trans fats increase LDL cholesterol and atherosclerosis risk, contributing to MI. Fiber is beneficial, and protein and carbs are not primary concerns. B is correct. 37. What vital sign is most critical to monitor in acute MI? A. Blood pressure. B. Heart rate. C. Respiratory rate. D. Temperature. Answer: A. Blood pressure. Rationale: blood pressure is critical in acute MI to assess perfusion and detect complications like cardiogenic shock. Heart rate, respiratory rate, and temperature are monitored but are less immediately indicative of stability. A is correct. 38. What is the mechanism of morphine in MI treatment? A. Reduces preload. B. Increases oxygen supply. C. Prevents arrhythmias. D. Lowers cholesterol. Answer. A. Reduces preload. Rationale. Morphine reduces preload by vasodilation, easing myocardial workload and relieving pain in MI. It doesn't increase oxygen, prevent arrhythmias, or affect cholesterol. A is correct. 39. Which condition increases MI risk by causing endothelial damage? A. Hypothyroidism. B. Hypertension. C. Anemia. D. Osteoporosis. Answer. B. Hypertension. Rationale. Hypertension damages endothelium, promoting atherosclerosis and MI risk. Hypothyroidism affects metabolism, anemia reduces oxygen delivery, and osteoporosis is unrelated. B is correct. 40. What indicates a non-STEMI on an EKG? A. ST elevation. B. ST depression. C. Q waves. D. Tall T waves. Answer. B. ST depression. Rationale. ST depression or T-wave inversion indicates a non-STEMI, reflecting subendocardial ischemia. ST elevation is STEMI. Q waves show prior MI, and tall T waves suggest other conditions. B is correct.